Okay, think about the absolute most advanced medical tech we have today. We've got robotic surgeries, AI-driven diagnostics, and just miraculous pharmaceuticals, right? But here's a pretty sobering truth. Even with all of that incredible technology literally at our fingertips, if a doctor and a patient aren't truly understanding each other in the exam room, health outcomes absolutely plummet. Turns out, the most critical medical instrument we have isn't a scalpel, it's communication.
Welcome to this explainer. Today, we've got a really clear roadmap. We're going to start by unpacking the communication gap, then we'll move into a crucial mindset shift, humility versus competence. After that, we'll look at the psychology of language, talk about how to work with medical interpreters, and finally wrap up with some highly actionable strategies for better care.
All right, let's dive right into this with Section 1, the healthcare communication gap.
It's wild to think about, but the very words meant to heal can actually act as an invisible barrier. When there's a lack of genuine comprehension, we aren't just dealing with slightly confused patients. We're talking about delayed care, highly inefficient treatments, and in the worst-case scenarios, severe medication errors. These communication breakdowns are a systemic issue that directly impacts patient satisfaction and their willingness, or even their ability to actually follow through with their treatments. Moving on to Section 2, we're looking at humility versus competence, which is a seriously necessary shift in perspective.
To really get this, we've got to look at this groundbreaking 1998 paper by doctors Melanie Tervalon and Jan Murray Garcia. For the longest time, medical education was hyper-focused on this concept called cultural competence. It was basically this idea that you could take a class, memorize a few traits about a specific demographic, check a box, and boom, suddenly you're competent in their culture. Well, this paper completely dismantled that finite way of thinking.
And this brilliantly illustrates the core difference. Cultural competence kind of implies this finite endpoint, right? Like an easily demonstrable mastery of a fixed set of facts. But cultural humility, that is a lifelong commitment. It requires constant self-evaluation, self-critique, and actively working to redress those built-in power imbalances in the patient-physician dynamic. You aren't just learning trivia about a culture, you're actively choosing to remain humble about what you don't know. The authors highlight exactly why this matters with a super striking anecdote. Imagine a doctor lacking cultural humility. They might see a Cambodian child come in with linear marks on their skin and immediately jump to the conclusion of parental child abuse. But through the lens of cultural humility, that same provider learns that these marks are actually the result of coining, which is a traditional Southeast Asian healing practice. Lacking this humility doesn't just cause offense, it literally leads to dangerous, deeply harmful misdiagnoses.
Which brings us to Section 3, the psychology of language. Let's look at how words literally construct reality.
So there is a fascinating psychological principle at play here called the Sapir-Whorf hypothesis. Some people call it the linguistic relativity theory. Put simply, it suggests that language actually influences human thought and perception. In a medical setting, this means the specific words a doctor chooses to use literally shape the patient's perception of their own illness. The words aren't just describing a condition, they are actively constructing the patient's reality of it. To see this in action, let's look at a really eye-opening recent Nigerian study by Anonyurki and Onuha. They analyzed family medicine consultations all across Nigeria, which, by the way, is a country with immense cultural and linguistic diversity. They specifically zeroed in on how a doctor's tone, their use of medical jargon, and the way they framed information directly impacted patient trust. The results here were just staggering. When patients were exposed to positive framing, so, for example, a doctor saying, "Your condition is manageable," instead of focusing purely on the severe downsides, those patients showed a massive 72% adherence rate to their prescribed treatment. Positive language directly translated into positive health behaviors. So the crucial point is, look what happens on the flip side. When fear-inducing or negative language was used, like bluntly telling someone, "Your condition is severe," that treatment adherence dropped all the way down to just 45%. Fear-inducing language didn't motivate the patients at all. It just increased their anxiety and actually reduced their compliance. And the study found a very similar dynamic with jargon. Doctors who consistently simplified their explanations and dropped the complex medical terminology, they saw an 80% patient comprehension rate. But when they leaned heavily on medical jargon, patients experienced frequent, massive misunderstandings. It just proves that plain language is, without a doubt, a powerful medical tool all on its own. All right, Section 4, working with medical interpreters. Let's talk about bridging that literal language gap.
Listen, relying on a family member, a friend, or don't even get me started, a web app to translate, it is incredibly dangerous. Family members almost always lack the skills to accurately interpret complex clinical terms. Plus, there is a massive risk of information being withheld or distorted just due to family dynamics or simple embarrassment. And using minors, that is completely unacceptable. It imposes a terrible, lasting emotional trauma on a child to have to translate something like a terminal diagnosis for their own parent.
That is exactly why the Migrant and Refugee Health Partnership published this comprehensive guide. It sets the absolute standard for the ethical, safe use of professional, certified interpreters. The guide makes it clear that it is the clinician's duty of care to figure out if an interpreter is needed, especially when you're dealing with informed consent or really complex medications.
The guide lays out some really specific rules of engagement. You always brief the interpreter beforehand on the nature of the consultation. You speak in short, manageable segments to allow for accurate translation. But perhaps the most important point on this entire list is using direct first-person speech. The doctor should look right at the patient and say, "I would like to do some tests," rather than looking over at the interpreter and saying, "Tell him I would like to do some tests." It's all about maintaining the patient's presence and dignity in the room. And finally, Section 5, Strategies for Better Care. Let's pull all these puzzle pieces together.
Based on the 3 incredible source documents we've explored today, it all boils down to these core actionable strategies. Step 1, you've got to examine your personal attitudes using self-assessment tools, really embrace that cultural humility we talked about. Step 2, use simple positive language and drop the jargon to skyrocket comprehension and adherence. And step 3, always engage certified interpreters. Never rely on ad hoc translation.
Now, how do you guarantee these steps are actually working? You use the teach-back method. It is such a brilliantly simple tool. Basically, the responsibility for understanding rests entirely on the clinician, not the patient. By simply asking the patient to repeat the directions back in their own words, the doctor can instantly verify if their intended message was actually received, completely regardless of language or cultural barriers. Which leaves us with one massive, provocative question. Are we just treating diseases, or are we treating people? Because think about it, if you are only treating a disease, hey, medical competence is all you need. But if you are treating a person, a whole human being with a totally unique background, language, fears, and perceptions, you absolutely need cultural humility, intentional language, and crystal clear communication. Effective communication is not just some nice-to-have soft skill, it is a critical, life-saving medical intervention. Thanks for joining me on this explainer, and remember to keep asking the right questions.